Okay, so we're now recording. So Zach, take it away. And if I know you won't be able to see us in class here, so if anyone does have an urgent question, then I'll speak up, Zach, so that you know, since I know you can't see us once you're presenting. That sound good?
Yeah, that sounds great. So Travis, just interrupt me because I can't see anything except for my slides.
Perfect. That sounds good. All right, take it away. Thanks, Zach.
Okay, well, thank you, Travis. It's too kind of an introduction, but very happy to share this information to kinesiology students because I think that sometime in your career you're going to encounter either yourself or someone you know who's pregnant and is going to ask you some of these specific questions. So just to give some disclosures, my funding comes from CIHR and they're providing me with income so I can be here today and do this for you. I'm going to go over some brief learning objectives. Mostly, I'm not going to dictate everything that's on the slides. I put a little bit more information on the slides, and this is here for your own information. But by the end of this lecture, I hope that you're familiar with exercise in pregnancy, and you believe me that in most women, it's beneficial for the health of mom and baby. I'm going to take you through the SOGC, which is the Society of Obstetrics and Gynecology Canada /CSEP guidelines for exercise in pregnancy and the postpartum. And although they're fairly old, that's what we have to go with. And I hope to teach you that physical activity is a valuable tool for some pregnant women to help with management of pregnancy weight gain. This is, of course, in the absence of contraindications, meaning medical problems that would preclude or prevent a woman from participating. And hopefully show you some ways that you can encourage physical activity with your clients or patients. All this information that I'm going to talk about today is presented in this review that you can feel free to take a look at if you so choose. If you understand and appreciate the contents of this paper, you will ace any question that's on the exam from Trevor. So it's without question that pregnancy is one of, if not the most important developmental period. From a single cell embryo all the way to a human being in a period of 9 months suggests and validates that pregnancy is the time in human life that is the most rapid and most malleable to change. And these concepts are reinforced in a theory now starting to be more of a scientific fact that fetal programming or developmental programming and how the environmental factors during pregnancy that the baby experiences when inside the mom, whether they're beneficial, for example, physical activity, or adverse, for example, famine or nutrient deprivation, how these factors can alter the developmental program of the child and essentially set the child up for a life course of healthy life or set the child up for a life course of having a greater susceptibility to downstream disease. So all this to say that in this 9-month period of pregnancy, a lot of damage can be done, but on a positive note, a lot of great things can occur if healthy active behaviors are in place. So historically, physicians and care providers have discouraged women from participating in physical activity. And they did this for a couple of reasons. They thought that the core temperature of the mom would impede embryogenesis, that the risk and the jarring, the physical movement of being active when a baby's inside you would cause congenital abnormalities, and that there would be a lack of oxygen and nutrients to the baby that would ultimately disturb fetal growth. But it's safe to say, and I'm sure you would agree, that times have changed drastically. And on the left-hand side of your screen, you can see a child who was born in a very nutrient-deprived environment. And so 50 to 60 years ago, this may have been true. But today, it'll be no surprise to people who are familiar with Travis's research that we're forced to sit, that nutrients are easily accessible, and that obesity is highly prevalent. So our environment has changed, while our genes have really not changed that much. But what has changed is how our body responds to the environment that we're in. So today it's always important to move because we're forced to be sedentary so much of the day. And with respect to physical activity in pregnancy, there's only been a couple of systematic reviews and randomized controlled trials that are looking specifically at mom's activity on maternal fetal outcomes. Physical activity has been known as a teachable moment, and a teachable moment is one where people and patients are more adaptable and open to change. You won't encounter many pregnant women who say, nah, I'm not going to do anything. Most of them are eager to participate in healthful behaviors during pregnancy because they want the best start to life for the developing child. Some of our research has shown, though, that despite having the best intentions, some women are actually unaware of safe and effective exercise practices during pregnancy, and therefore this is a barrier to their participation. As mentioned before, pregnancy and exercise go together not only to help limit excessive pregnancy weight gain, but just optimize the physiology and optimize the nutrient delivery from mom to baby to help promote a thoughtful and adequate growth trajectory of that fetus. So ideally, we'd like all women to conceive at a healthy body weight. 1 in 2 pregnancies is unplanned, and 95 out of 100 people fail to succeed in a weight management intervention preconception. So you can see how that, from a public health standpoint, is probably not the best way to use our resources. Instead, we're focused on healthful behaviors during pregnancy in a way to optimize the health of mom and baby. So, since this is a physiology class, it's important to go over some of the adaptations that a pregnant woman will experience in her body when she engages in physical activity. Thankfully, and it's great test material, to know that the way that you and I'm not sure if there's anyone in that audience who's pregnant, so I'm not pregnant, obviously, but the way that a non-pregnant person responds to exercise is very similar to the way that a pregnant woman responds to exercise. So we all know that when we move more, our heart rate goes up, proportion to the workload that we're subjected to, our stroke volume goes up, therefore cardiac output goes up. We start breathing heavier and we have a deeper tidal volume. And all these things happen to the non-pregnant person. But what you can see down here is that placental perfusion also goes up. And that just simply means that the amount of blood that's delivered to the placenta increases. And I'll explain why this is important later on. And lastly, energy expenditure for a mom goes up, but this is in direct proportion to the amount of weight she gained and is relevant to only weight-bearing activity. It just makes sense that if a woman weighed more than she did when she was not pregnant, that there would be more work required to move the body a certain distance. So when shouldn't you exercise? And I'm not going to read this list to you, but this is for healthcare providers and allied care providers who are certified to clear pregnant women to exercise. But there are a host of absolute and relative contraindications in which a woman may not want to engage in activity, and this is for the benefit of her and her baby. For example, ruptured membranes is at the top. Ruptured membranes are the amnion and the chorion that surround the baby, the gestational sac, when the child is in utero. And of course, it would make perfect sense that that mom may not benefit from exercise the same way a mom who had intact membranes would. But it's important for kinesiologists, dietitians, exercise physiologists, physicians, all allied care providers to recognize that if you simply tell a woman that she's pregnant to kick her feet up, to rest, and protect the baby, you have to weigh the detriment that you might be doing both to the mom's health and fitness, but also to the baby's growth and development. And you can see on the screen here that there are some things that may occur in the mom, for example, detraining, excessive weight gain, increased risk of pregnancy complications if she doesn't engage in physical activity. And of course, there's the mental health component as well. We all know that physically active people report better mental health and quality of life scores, and the same holds true in pregnancy. And physical activity appears to be a great way for the mom to adjust psychologically to the drastic changes that are happening to her body inside and out during the 9-month period. So it's safe to say that we are designed very uniquely in a very sophisticated way that we're only beginning to tap on the tip of the iceberg. And that truly, as long as there's adequate maternal nutrition, which is the case for the vast majority, 99% or more of the people today, then the baby is not in any harm, and neither is the mom. As long as there's adequate energy on the mom with respect to adipose tissue, energy stored in adipocytes, liver glycogen, adequate meals spread throughout the day, then there is no way that the fetus will be deprived of energy, because during pregnancy, moms naturally go insulin resistant. And this is a unique phenomenon that happens during gestation, so that nutrients are preferentially shuttled to the baby to support placental and fetal growth and development, when mom's diet or nutritional intake can stay essentially the same. There are specific recommendations for women struggling with overweight and obesity. They have a different phenotype than individuals who are not struggling with weight, and here are the heart rate recommendations for these individuals. I've also posted here the recommended weight of gestational weight gain for women carrying singleton fetuses. That means women carrying one baby inside them and not twins. And for the exercise enthusiasts in the room, Table 4 highlights a sample exercise prescription for pregnant moms who don't have any of those contraindications. And although it seems very simple, it's this practice here that can have tremendous benefit to the health of mom and baby. And you'll see that the trend is very simple. Starting off with lesser days a week, very short duration, working their way up to 30 minutes, doing low impact aerobics, and working their way up to 4 days a week, moderate to vigorously active, 30 minutes or more per session, but again, low impact aerobics.
And Zach, is that assuming it's a woman who's not active before pregnancy, or just someone who is active before she becomes pregnant?
Great question. So on the left-hand side, previously sedentary would be the mom who
Gotcha.
hadn't participated before. And then on the right-hand side is a mom who was active, recreationally active before. But as I'm sure Travis can reinforce, is that women who are much more active pre-pregnancy, for example, Dawn, they're capable of doing more work. And we'll get into it after, but it's more about maintaining your fitness opposed to trying to make gains in your fitness. So just to cover your ass and make sure that everything's okay, as a CSEP CEP, it's very important to follow the proper procedures and protocols. And what we do is we medically screen women who are interested in being active during pregnancy, and we use the PARMEDX for pregnancy. This is very similar to the PARQ for exercise participation, but it's catered specifically to pregnant women. It's available here, and what it does is go through a series of checklists, and I've highlighted it here again, as well as all the contraindications to participation. It even goes as far as providing a sample exercise prescription for women in pregnancy. Then you sign off with your care provider, so CEPs can sign off, and of course family physicians can sign off. And then you take this back to your personal trainer, your exercise coach, and you continue on with the program if you're cleared to go. So when should we start exercising if we haven't before? The research suggests that if you're comfortable starting in trimester 1, that's perfectly okay. But many women self-report that they prefer to start in trimester 2 because of the morning sickness and the nausea that is attached to trimester 1. And then they also prefer exercising in trimester 2 versus trimester 3 because by the time they're in trimester 3, their bodies have physically changed, and it's what we call constrained. The baby is growing and developing, and of course now you have a large protruding abdomen that may prevent you from doing some of the comfortable physical activity that you enjoy. This is not to say that you can't. This is just what most report. However, there are quite a few women who exercise all the way through pregnancy. And of course, on the flip side, there are some who do none, and we're trying to meet in the middle. So just to reinforce again is that there is no teratogenic or negative effect of maternal core temperature on the development of the baby. Human beings naturally withdraw from physical exertion when they're stressed too greatly. So we have a way to regulate our heat balance and fluid balance in pregnancy as well. And so a mom would actually tap out and stop exercising before there was any detrimental effect.
So you're not going to cook the baby a bit, for what you're saying?
Absolutely not. Absolutely not, no. And that just, unfortunately, well, I guess it's fortunate that science just proves common sense quite often, and this is the case. And I'll show a case study at the end where a woman completed a marathon at 39 weeks. So what are some reasonable training goals? For the average individual, maintaining their fitness is perfectly normal, and we try to discourage people from making performance gains and try to think about the baby and try to paint the picture in a more positive light, that you can maintain your fitness, but we ask that they don't train and try to peak and break any personal best during pregnancy. The evidence is fairly good on that. For elite athletes who may have more specific needs, and it might be more relevant to kinesiology students who go work with these individuals, this requires a very thoughtful and open relationship with your obstetric care provider. If you're more open, they're more likely to pay attention to small and subtle cues that might be indicative of maternal or fetal stress. And of course, as long as biochemical and morphological measurements are okay in the mom and the baby, then physical activity can continue. So there may be a need in cases of elite athletes to refer off to a physiotherapist, physiologist, sports med doc, who have a specific interest in physical activity in pregnancy, so they know the caveats and they know what to be aware of. With respect to intensity, of course you can always follow these heart rate monitors and this and that, but that's not necessarily accessible to the masses. What we do encourage is the use of the talk test, and I'll get into that after. But it's clear from the evidence from my colleague Stephanie out of the Michelle Matola's lab in London that a walking program of low and vigorous intensity can confer an aerobic benefit. So of course, vigorous had a greater benefit, but only marginally better. So the number one reported mode of exercise in pregnancy is walking, and even low intensity walking, simply walking with your partner before or after supper, meeting the physical activity recommendations, of course interrupting your sedentary behavior in small bouts throughout the day, right Travis? But these low intensity excursions can actually do quite a bit of benefit with respect to cardiovascular fitness. So in 2012, this group put out a paper suggesting that maternal exercise in elite athletes, so in Olympic hopefuls, so these were women who were going to be on the Olympic team, that physical activity harmed fetal well-being. And what they showed was, I'll orient you to the right side of the screen, we have fetal heart rate along the X, we have maternal heart rate along the Y. The gray box highlights what a normal fetal heart rate would be. As you see, fetal resting heart rate is naturally higher than an adult resting heart rate. But when the mom was exercising below 90%, most of the observations were a fetal heart rate were within the normal range. However, when mom was exercising above 90% of her VO2 max, so this is 90% of VO2 max in an elite Olympic runner, fetal heart rate was shown to drop outside of the range. Now, if I can take you over to this side, and looking at the graph on the left-hand side where there's percentage of blood flow along the Y, and then each stage of exercise for a single subject along the X, as you see, as the mom goes progressively more intense exercise, uterine artery blood flow was cut to 50%. Now, this was a cause for concern for these scientists and physicians in this paper, because what they showed was that if mom's exercise is above 90%, the uterine artery blood flow drops and fetal heart rate drops. Now, the take-home point of this paper is that they only measured fetal heart rate. They didn't measure heart rate variability. A second part was that these individuals recovered immediately upon cessation of that exercise. So as soon as the mom stepped off the treadmill, uterine artery blood flow went back up to 85%, and fetal heart rate went right back into the normal range. So while it might be indicative or a red flag for these very niche market of Olympic athletes, this message shouldn't be propagated to the masses. First off, I doubt there's anyone in that room who could exercise at the intensity 90% of an elite Olympic runner. So just to suggest that it's probably not the best public health message. So how can you mark?
On that note, I think Dawn couldn't do like above like 60%. Not that she's Olympic level, but like Dawn runs a lot, and she could not do anything intense at all, and she was pretty fit. So like, I can't imagine any person off the street wanting to do that on a daily basis.
No, and the problem is that the media got a hold of this study, and they started to say exercise in pregnancy harms the baby. But they didn't understand the nuance that this was in a very niche market of the population who was trained, and they also failed to mention that there was complete recovery of the physiological systems in the baby as soon as the mom stopped with the exertion. So what can the average Jane do to gauge her intensity to make sure that her baby is safe and that she's exercising at the right level? I'm sure you're well aware of the Borg scale, rating of perceived exertion, where you can self-identify how hard you think you're working. What I found very useful while working in the field with these women is the talk test. If they're comfortable exercising and having a conversation with me or their trainer, then they're safe to say that they're okay. So what is the evidence to suggest that aerobic exercise is beneficial for pregnancy, and what effect does this have on maternal fetal outcomes? Well, as of 2006, updated again in 2009 in Cochrane Systematic Review, 14 trials over 1,000 pregnant women, they were only able to conclude that physical activity was beneficial to improve or maintain aerobic fitness in the mom, and that there was weak evidence to suggest that it may help minimize some adverse events during pregnancy, but they weren't able to conclude anything because of the differences between the trials included. So even on that note, it's just important to know that aerobic can be made or maintained, and this is very important because cardiovascular fitness is the #1 predictor of death and dying in humans. So what about weight training or resistance training? I'm sure you may have seen this picture in the news. It was quite popular a few months back, where a woman was doing CrossFit when she was pregnant, and everyone and their mother was criticizing her or praising her. It was kind of a mixed bag. The important thing to know is that the scientific evidence on strength conditioning in pregnancy is very weak right now. There are very few studies that actually examine the effect of weight training or resistance training in pregnancy. The most important information to pay attention to is that this woman here was highly active pre-pregnancy. She carried on exactly what she was doing during pregnancy. She delivered an average-sized neonate that was healthy, and she had no contraindications. So, again, probably a unique case and not representative of the mean or the median pregnant woman in today's society. The most important caveat for physicians, personal trainers, and anyone working with pregnant women to know is that they should modify their exercise to avoid the supine position after 16 weeks. And this is strictly for the reason that it may cause hypotension because the vena cava may be compressed by the pregnant uterus. So avoid lying on your back to do any of those exercises. Make small adjustments to the bench so you may be on an incline position. Stand up and do upright exercises with cables and bands, things like that, just to avoid this potential risk. Of course, during pregnancy, as your belly expands, you develop what they call a diastasis recti, which is a separation down the medial aspect of the abdominal line, and this does impede several women from participating in different types of resistance training. I get a lot of questions about stretching, yoga, and Pilates. Unfortunately, at this time, I have to say be open with your care provider and follow your body signs, because there's no evidence to suggest that they're helpful or harmful. So how does the body respond to exercise during pregnancy? It appears to be mediated through the placenta. The placenta is the main interface between the mom and the baby and responsible for removing the toxins from the baby's blood, but also pumping oxygen and nutrients to the baby so it can grow. And as pregnancy develops, placental blood flow increases, cord blood oxygen saturation is maintained, and glucose delivery is maintained. Now, this is all to do with these three mechanisms I have outlined on the page. Hemoconcentration increases, therefore plasma volume decreases, therefore the contents in the blood is at a higher concentration than it would be. Cardiac output increases during exercise. That means that the heart is pumping harder per minute and delivering more blood per pump. And there's a perfusion balance in the placenta, simply meaning that these two factors, 1 and 2, feed into number 3, and essentially you can think of a fire hose pointing at a door, and during exercise, you turn the fire hose on, there's more blood pumped through this small gateway, and even if there was a small decrease in glucose in the mom's blood at the onset of exercise, it's compensated for by the amount of blood presented to the placenta. So we've also tried to examine more recently, how does physical activity alter the nutrient delivery to the baby? Because we're very interested in understanding how some women are predisposed to having excessive weight gain in pregnancy, and how that excessive weight gain contributes to excessive fetal growth and downstream child obesity. So my colleague Kendra recently published this paper in Placenta that looked at prenatal physical activity and diet on nutrient transporters in the placenta. What she showed was, I'll just orient you to this graph. On each of these graphs, moderate to vigorous physical activity as measured through direct measures accelerometer is along the x-axis in all the graphs. And fat transporters on the D, mTOR, which is a marker of it's a nutrient sensor in the placenta, E, and IGF-1. IGF-1 is the main growth factor in the placenta on F. And what you see that as moms become more active, the rate of expression of fatty acid transporters, the main mechanism which is fats transported to the baby, is decreased, suggesting that physical activity protects against fat delivery to the baby. On the panel marked E, as physical activity is increased, we see a decrease in this growth promoting factor, which is called mTOR, which is a nutrient sensing molecule that essentially signals other factors in the placenta to transcribe and express transporters to deliver those nutrients. And then in panel F, as physical activity in those moms increases, there is a decrease in the expression of a growth promoting factor. So collectively, all this suggests that physical activity helps regulate and optimize growth-related parameters, adding more proof that an active pregnancy can protect against dysfunctional growth. So I want to go back to that study about the Olympic athletes, because in that study they showed that fetal heart rate dropped, but they failed to look at heart rate variability. Now, if I was to ask any one of you, what would happen if you trained 6 weeks in an aerobic training program? Would your resting heart rate increase or decrease? Safe to say, most would agree that it would decrease. And if I asked you what happened to your heart rate variability, it would increase. And this is indicative of a training stimuli. The same response system to physical activity was demonstrated by May and colleagues in 2010 when they put women on a treadmill and they attached them to this magneto-electrocardiogram, this Hubble telescope looking like figure. And as the moms exercised, they showed not only that fetal heart rate decreased, but heart rate variability increased. Markers of fetal stress in the cord blood and amniotic fluid did not change, so there was the same amount of oxygen delivered to the baby. And so the authors concluded that maternal physical activity induced an adaptive response in utero that was similar to aerobic adaptations in non-pregnant people, and they suggested that this should be the current way moving forward to look at physical activity in pregnancy. So there's not alarm bells ringing off when they see a drop in fetal heart rate, because they too saw a drop in fetal heart rate, but it was in line with an increase in heart rate variability. So there was no adverse effect in utero.
Exactly. So are you saying basically the babies got fitter as a result of their mom's exercise?
I mean, that's what the media would say, and I would use that with caution. But they actually have continued to follow these babies at to year 2 now, and these changes, these physiological adaptations, have persisted. So when the moms who exercised, the fetal heart rate still was lower than a sedentary control, and the heart rate variability was still higher than a sedentary control.
Whoa.
So very novel evidence using a sophisticated technology in a small clinical study to just offer a small piece of the puzzle. So what about energy expenditure? Everyone's concerned about calories in and calories out. So how does pregnancy affect energy expenditure? Well, during pregnancy, it's altered at rest and with physical activity. There's a small increase in maternal energy expenditure as a result of pregnancy, but the general rule is that energy expenditure in pregnancy is commensurate or directly proportional to the amount of weight the mom has gained. So the metabolic cost of physical activity increases from early to late pregnancy because moms tend to gain more weight later in pregnancy. How does the MSK system adapt? Well, you'll probably know someone who's pregnant or know of someone who was pregnant that they complain about physical discomfort as pregnancy progresses. And this is quite a common self-reported phenomenon. It makes perfect sense given that you have another human being growing inside of you. But here are some of the anatomical changes that occur during pregnancy and maybe reasons why women report feeling a little bit different. There are some hormonal factors that cause this discomfort. Of course, excessive pregnancy weight gain, gaining too much too soon, can lead to excessive discomfort because your body fails to adapt to the load that's imposed. And there is some evidence to suggest that physical activity can help minimize this discomfort. I use the analogy to arthritis. If you are diagnosed with arthritis and you stop moving altogether, you'll essentially seize up and report more pain. But if you keep moving and try to do your best to do a little bit day by day, your quality of life and your movement will be improved, and the similar phenomenon can be seen during pregnancy. What about diabetes in pregnancy? It's very common to see women first present with diabetes during pregnancy, and that's known as gestational diabetes. Of course, there's drug treatments available, insulin and metformin. They come with their own safety concerns, so it's always better to try and modify lifestyle first. The frontline and most effective treatment is a combination of physical activity and diet modification, and it has been shown that moms who are active before and during pregnancy have a lower risk of getting diabetes compared to moms who are inactive. Something that's more preliminary but very interesting is the effect on preeclampsia. Now, preeclampsia is a condition in pregnancy that causes hypertension and protein in the urine. You most have these two factors combined. And what preeclampsia does is it changes the vasculature of how the placenta embeds into the mom and how nutrients, gas, and oxygen are exchanged. The very fascinating aspect of this is that physical activity essentially has the exact opposite effect on the vascular system in the placenta, where active pregnancy and active moms have placentas that have greater vascularity, less prone to oxidative stress, more responsive to to vascular flow and flow-mediated dilation. The bottom graph here is a remodeled placenta of a mom who has preeclampsia. You can see constricted vessels. When you have constricted vessels and same flow, you're going to increase pressure. Here you have a picture of a normal pregnancy, which would be very similar to an active pregnancy. Much more space in the arterial system, endothelial is functioning properly, the placenta is implanted perfectly nice into the endometrium and the myometrium, and so it helps maintain flow. So there is some preliminary evidence to show that. More importantly, well, not necessarily more importantly, but definitely impacting a larger number of women would be the risk of having an overgrown baby. And I show this here because these are growth charts that care providers use to track how their infant's growing. In between the space highlighted by the arrows is normal growth. Anything above is considered overgrowth or large for gestational age. I've put this picture here just for reference. The middle baby clearly is overgrown in the 99th percentile for gestational age. He's actually the third heaviest baby ever born. Ladies, don't worry, it was by C-section, so it's okay. And on the left and right of that child, you have appropriate for gestational age babies. So you can see how the child in the middle may have a different trajectory and different health status throughout life than the child on the left and right. And we care about this for a couple of reasons.
Yeah, sorry, I know I was putting on the spot, but what is the largest ever baby born in terms of weight?
I have to say it's over 18, but I'd have to verify that for you to make sure.
And it was. Do you know what the largest is for vaginal birth?
Oh, didn't we talk about this before? I think we might have talked about it. I'll get that information and send it to you, just so I'm not making things up. I want to give the correct information, but yeah, no, it would surprise you what the largest baby was. I remember looking at it, but I can't recall the exact statistics, so I don't want to say right now.
Okay, no.
Follow the evidence, yeah. But okay, so let's go. So what happens in the placenta? I'm not going to get into it specifically, but here you can see how it develops from very early on in gestation. Here's a graphic, but then here's an actual true image of what's actually happening, which I thought was very cool to see. These things are called villi tree, and these villi tree are essentially vessels intertwined, and this is the interface of exchange between the mom and the baby. So when we actually were doing those placenta studies in the pregnant moms and looking at nutrient transporters, we take the placenta after delivery when everything's okay with the baby, and we flip it over and we biopsy this small part at the tip of the tree, because that's the exact area where nutrients and gases are exchanged. So you can tell by the distribution and density of the transporters on that interface how likely it would be for nutrients to cross over. And so here's some things that happen during pregnancy and help promote optimal growth and development. You can see that surface area increases. As mentioned, the perfusion rate, or the rate at which blood is splashed against the placenta, increases, blood flow increases, and all this helps optimize growth. Okay. So we're very concerned in my current role at the Ottawa Hospital, but also where I used to work with Travis at CHEO, about healthy weight gain, because we've shown over and over again now that healthy weight gain promotes healthy child birth weights. And so for those who are really concerned about what to gain during pregnancy, and this is going to be a common occurrence if you're in the field as a kinesiologist or physiotherapist, nutritionist, these are the evidence-based guidelines, and unfortunately most care providers are not familiar with them. So it's important to have this as a reference moving forward. The trend is, though, the lighter you are pre-pregnancy, 18 kilos upper limit, versus obese pre-pregnancy, 9 kilos upper limit. The lighter you are pre-pregnancy, the more you're allowed to gain. The heavier you are, the less you're allowed to gain. It's important to get a direct measure of that mom's pre-pregnancy BMI, just to make sure that they're getting the proper information. There's even more recent evidence to suggest that moms with obesity greater than 30 for example, BMI 35, 40 and above, can actually gain no weight during pregnancy.
And Zach, just to clarify, that's the weight that the mother gains, right? That's not subtracting like the weight of the baby or the water. That's like just the mother's weight as it progresses with baby and water, all that included, right?
Exactly. Yeah, absolutely. This is if the mom stepped on a scale at 20 weeks, 25 weeks, 30 weeks, it's total weight. And so some find it hard to use this total weight gain. For those who do, this is probably better. You use this weekly range of gain. So if they're gaining 0.2 kilos or half a pound per week, if they're struggling with obesity, up to the maximum of 1 pound per week. Anything greater than that would be a great reason to have a conversation with your care provider and try and troubleshoot that problem. So why do we care? Well, we care because we know that excessive weight gain leads to big babies. And here's a meta-analysis that's old now, 2011, but fairly conclusive to show that if you're born big at 18 years old, you're going to have a greater than 2 times risk of being obese. We've also shown, well, not us specifically, but the individuals, the scientific community interested in this topic. Here's another study by Struling where they did a meta-analysis and looked at all the randomized trials of physical activity alone. And they showed that when mom is active and adheres to the program, the effects on gestational weight gain are great, and that they're actually gaining more within the guidelines, and it's a great tool to help manage pregnancy weight gain. Moving forward to 2014, this has been a novel contribution by Dana Davley's group, who showed that physical activity can improve offspring body composition. And so when they compared moms in the highest tertile, so the most active moms, to the lowest active moms in the reference group, they showed that fat mass decreased, right here, fat-free mass stayed the same, and birth weight decreased, which clearly suggests the change in body composition for the better, and that these neonates of active moms had 41 grams less fat. This may seem insignificant, but the babies are small, and this is a significant amount of weight at this early age. The take-home point was that moms who followed the exercise and pregnancy guidelines didn't add any harm, but improved the body composition of their baby. So, what can care providers do? Here is a tool that many use to promote physical activity by writing a prescription. Doesn't take much. And lastly, a case study. So this lady here, Danielle Miller, 27 years old, she completed a marathon in 6 hours. A lot of people thought it was crazy. They wrote letters to the newspaper and to the scientific journal saying, is this accomplishment or is this a hazardous? What about the baby's health? A lot of people accused her. 8 hours after the marathon, she essentially ran into the delivery room. She gave birth to a healthy girl. The important thing to know is that here's the verdict. Was there excessive heat stress? Not at that pace she was running. I'm sure Travis, I've never run a marathon, but Travis is the runner, and he can tell you that that pace is not truly maximal, and that it's a very casual pace for someone who is trained and fit. So she wasn't generating an excessive amount of heat. Fetal heart rate at that intensity was unlikely a problem either. Did she have a small baby? No, she didn't. Was uterine artery blood flow diminished? Based on the evidence I've shown you previously, most likely not. At that speed, adequately nourished? Did she have blood sugar issues? No. Did she have enough fuel to finish the marathon? The answer is categorically yes, because she did. Would cardiac arrest be a problem in this mom? And the scientific community said no. Mom's heart rate was less than 85% of her max. This is taken from the Journal of Physiology in a pro-con debate between exercise physiologists when this study came out, just to show that it is unlikely to harm if this is the case. Although very abnormal behavior to want to do that, to each their own, and a thoughtful conversation with the provider can help minimize the harm. So, as we conclude here, it's just important to know that elite athletes have to take extra care to monitor their heart rate in training zone. They might want to limit abrupt jarring impacts. there's no evidence behind this statement. This is me just being cautious. For example, plyometrics may not be the most advantageous exercise. It's important to aim to maintain, follow your body, and don't be afraid to ask certified professionals about help and assistance. So the take-home points: for most women, exercise is safe and optimal and effective for many things for the mom and the baby. Of course, the caveat is make sure that they don't have those contraindications. It's better to start preconception to minimize the risk of certain pregnancy diseases such as diabetes and preeclampsia, but every little bit helps offset the risk. It seems to be a valuable tool in adjunct with healthy eating to limit gestational weight gain, and that the baby appears to positively adapt to physical activity. So I hope you enjoyed that quick little summary of exercise and pregnancy, and if you have any questions, feel free to email me or you can ask them now.
All right, Zach, thank you. That was awesome. We've got like 3 or 4 minutes. Does anyone have any questions about exercise and pregnancy? Or what's okay or not okay? So while you think, or if you want to think about that, Zach, I was wondering, you said so exercise is good, like it sort of combats the impact of preeclampsia. Are women with preeclampsia, are they allowed to exercise, or is that one of the contraindications?
So it is actually one of the contraindications. So those were studies, observational studies that followed women, and the women who were active were less likely to get. Let me just go back to the contraindications so you can see those again. Yeah, those were taken from observational studies.
It seems plausible that it might actually help counteract preeclampsia, but there's no actual research on it yet.
No, and there is some very preliminary reports coming out recommending that women who used to be recommended for bed rest for certain contraindications, that they're now encouraged to do slight movement, not exercise, not even physical activity, but just walking and interrupting the sitting. So interrupting the sedentary time might be a way to go. Now, there's no studies on this. It's just very, very, very preliminary. So you can see here from the slide, relative contraindications, hypertensive disorders of pregnancy, and that includes preeclampsia, because preeclampsia is hypertension with protein in the urine.
I should mention, Dawn actually did a 15K when she was, I think, 7 months pregnant. We also took up speed skating, but then she thought that would be a bad idea. She stopped speed skating later. Which started to show her balance got thrown off, so she stopped. But she did 15K in Grande, New Brunswick, and she beat people. She beat some high school guys. She was pumped with that. But then, like Zach mentioned, once she got any further into the 3rd trimester, it was just way too uncomfortable to run. So she biked a lot. We did an overnight camping trip to Brackley. So we biked up, spent the night, biked back, and that was when she was like 8.5 months. We went really slow. And actually, I wanted to bookend this with having John and Katie and a couple people come in and talk about their perspectives during pregnancy rather than 2 guys talking about it. But we had too many snow days. And so, Zach, I think you covered that all really well. So thank you once again, Zach. I really appreciate your time. And,
No worries, thanks, Travis. And for the guys in the room, don't be afraid to get in the area. It's just one more tool in the toolbox of the exercise physiologist. I don't spend all my time doing this, but it's a nice add-on, let me tell you that, because there's not a lot of people specializing in this topic.
well, thanks for sharing your expertise, Zach. Have a great morning.
Thanks, Travis. Take care.